Joining us now is Dr. Rubecca, and she comes from Seattle. And I'm super excited because Seattle, you're one of our new cities. So, hello and good morning. We are so happy to have her here because she owns Smiles on 35th. Welcome to the show. How are you?
I'm good, Donna. Thank you for having me on the show.
It's so exciting to have you. And I was so honored that you decided that you wanted to come and celebrate your practice with us. What's new and exciting for you is that you're expanding.
Right,
Okay,
yeah.
so how did that come about?
So a store next to our practice opened up, and we got this opportunity where we could take that place and make it into more optometries so that way we could help more patients of ours.
Were you surprised when you first opened? Because you opened, was it like right before COVID? Okay,
Correct.
okay. So you've had some challenges as a business owner. Are you so excited though now that it's you're expanding and you're going to be able to open up new avenues for people?
Yes, I'm totally excited. It's my vision to help more and more people. Dentistry is my passion. I come from a family of doctors, and it's ingrained in my blood to help more people. They have to have better smile, better health. It's extremely important because I always say everybody that our body, our health is the biggest gift somebody can have.
What's so interesting is you have a biomimetic, did I say that
Yeah,
correctly?
correct.
Biomimetic dentistry practice. What is that?
So biomimetic, what does that mean is we mimic the biology of the tooth.
Hmm.
So we use materials which are exactly mimicking the tooth structure which is lost. So you know how we have tooth where we have enamel, we have dentine, and we have the nerve. So if we take out dentine, we actually use enamel, we use dentine replacements, and then we use enamel replacements to actually restore the tooth into its rightful place, I would say.
You also had mentioned too when we were talking on the phone about only touching a tooth once.
Ex-
Like not exactly, but what does that mean? So like you're going to do such a great job that once it's there, it's like a new tooth for them?
Exactly, because if you follow the proper protocols and do the right technique, and then the tooth is restored, it should not be touched back again. That's
Okay.
my thing. So whenever I'm doing a work, I want to make sure that it lasts for a long time.
And the equipment you have is state of the art, right?
Correct.
What made you decide to invest in that and what does that do? What are some of the tools that you're using?
I love technology. I have AI for my radiographs so that I can explain my patients everything. I have a CEREC machine, so I actually make my crowns and overlays in my own office. I use something known as ribbon, which is a fiber, so that which gives strength to the tooth. It's like a Kevlar mesh. I have a CO2 laser, which is a soft tissue laser. I just love technology. I have a T-scan, which is like a machine where we actually can take a look at the bite of the patient if something is going wrong. So I just love technology.
And being in Seattle, because that is a technology hub, right? I think it's important
Yes.
that because you're serving that clientele, right, that you have all these like really cool tools at your disposal to have the best of the best, right? What is one story, I guess? Is there like a patient, maybe a patient story that sticks out for you and how that was like life changing for them when they had the dental
So
work done?
yeah, Donna, I totally remember a patient. We can call her Sarah for privacy issues.
Okay.
She is a young, successful professional in her 40s. Everything was going great in her life, but the only thing which held her back was her smile.
Hmm.
She had these old-looking discolored teeth, and which made her not smile when taking photos. Whenever going out to eat, she would cover her mouth.
Oh
She would
my.
feel embarrassed. One day she said enough is enough and she wants to change her life. She found me through one of her friends, and she came to my office. We discussed what was going in her life, her insecurities, what does she want out of the whole process. And after careful considerations, we decided that cosmetic veneers are the route to go.
Okay. So you did veneers for her.
Correct, yeah.
Okay.
And I still remember the day when we installed the veneers in her mouth. She looked in the mirror and, tears rolled out from her eyes, not from sadness, but from pure joy. She was able to see herself, what she truly was from inside. And it gave her the confidence because that smile was not some fake smile, but it was truly hers, radiant and full of life.
One of the pictures that I had seen too is that there was a person that had like a chipped tooth, like their whole front of their tooth was like a diagonal kind of,
Yeah.
like, and you were able to like replace that, like bond it, I guess, or something, and you created something that looks like a real tooth.
Yeah, I had a 14-year-old girl came in to my practice, and schools were starting, and they were of course concerned because high school, right?
Right.
So I took my time and I made her tooth, exactly like how her other teeth was. So it was her front tooth. So it's very important to actually match the other tooth. So it took me a little while, but we were able to match it perfectly, and she was very happy.
I love that artistry about you. I also am impressed, Dr. Rebecca, the amount of new learning that you do. Like you go to classes still and you're always learning about new things, as far away
Definitely.
as London. So you're taking classwork and like bringing it all back to Seattle.
Yes, I take a lot of courses. For our requirements, we need 63 or 62 credits in 3 years. I take more than 100 a year.
You do.
Yeah,
Okay.
so I do travel a lot. I love education. I think it's my passion to learn new things to be able to help my patients. I can actually take a look at a patient's mouth and I know if they're sleeping well, breathing right. So all those things are
Dr. Rebecca, wait, I don't know, but yeah, sometimes I don't sleep as well.
It's all a part of functional dentistry. It's not just our teeth, it's our whole body which affects. So when I take a look at the patient, I know if they have an issue with sleep, if they are having issues with their bite, where they are breaking their teeth. Because if you break your teeth, how are you able to enjoy the foods? I want people to enjoy their social life, their professional life, and have a food with their friends and family. Donna, imagine if you were going on a class reunion and you had your former husband with his new wife, and you walk in there looking 10 years younger. Wouldn't be that something?
Woo. I like that. That's an attention grabber, right?
Yeah,
Yeah, you're right. I understand what you're doing. So you really are there to help people with their health, I guess, their beauty and their confidence.
correct.
And as a community leader, what do you love best about Seattle?
Seattle, I think, it's a aggregation of culture. We have so many different communities over there. I love helping people. It's an immigrant city where, people come from different parts of our life, and there's so many tech jobs. So I get to meet so many new people. I think that's what I love about Seattle. There's so many greenery around, mountains, everything is there. It's such a beautiful place to live with your family.
One of the things you told me too is that you do professional whitening,
Correct.
right? Which is important because if you're drinking a lot of coffee, Dr. Rebecca, then you also have clients, right? I always used to laugh, like when I would leave the dentist office, they'd always give me a lollipop, and I'd be like, they probably just want me to come back. But it's not just like over the counter whitening.
No.
You are suggesting that you work with a couple of top brands, right?
Correct.
Okay.
Yeah. So there are a couple of brands which I love. One is Cord, the other one is Zoom, and I do whitening
Ta-da!
myself.
There you go.
Yeah, I love coffee. I'm an avid coffee drinker, but that doesn't stop me living my life.
There you go.
Yeah.
I thank you. Thank you. I got a chance to meet your husband and your beautiful daughter. We got to have dinner last night. And I just sincerely, I'm so happy to know you and wish you continued success on your journey.
Thank
So,
you so much,
and I'll be
Donna.
up to Seattle soon.
Yes,
I
you're
definitely will. I will definitely be there.
you're
So
you're welcome
thank you.
anytime.
Great stories there too, like the big, gigantic, Ferris wheel that they have. So, Seattle is one place I haven't been yet.
You need to visit there and go to the Pike Place Market as well.
There you go. And Smiles on 35th.
That's
Oh,
totally true.
thank you so much. Stay tuned for more. We've been living it up right here. And wherever you are, please just have that smile on the inside of you. Just come right forward. And if you need a little help with that, I'm sure Dr. Rebecca is the person to call. Be well.